everyone, today the topic of discussion is treatment for psoriasis. So, what do you mean by psoriasis? It is the chronic disease which is T-cell mediated inflammatory disease targeting mainly the skin and also the other organs. So, treatment modalities of psoriasis is mainly based on percentage of body surface area involved. If it is less than 10% of body surface area involved, it is mainly with the help of topical therapy. Whereas, if it is more than 10% of body surface area involved, it is with the help of systemic therapy as well as the help of phototherapy. So, topical therapy. So, aim of this therapy, topical modalities of treatment. So, aim of this therapy is to reduce the scale and also act as an anti-inflammatory. Next, DNA synthesis inhibitor, and then you have drugs which normalizes the keratinizations. So, for reducing the scale, the drugs included are going to be moisturizer as well as an emollient. Next, you have an anti-inflammatory which is the help of a topical steroid. Next, DNA synthesis inhibitor. It is done with the help of a drug called coal and then you have the dianthanol. Next, to normalize the keratinization, the drugs included are going to be vitamin A analog and then vitamin D analog. In vitamin A analog, which includes retinoid drugs, whereas vitamin D analog, which includes the calcipotriol group of drugs. Vitamin D analog, which includes calcipotriol. Next, if topical therapy is not applicable, next that is if more than 10% of body surface area involved, next we have to follow phototherapy or either systemic therapy. So, phototherapy which includes two regimens, which includes Gaukerman's regimen and then you have the Ingram regimen. In Gaukerman's regimen, which addition of coal tar along with the narrow band UVB rays. In Ingram regimen, which includes coal tar, dianthanol and application of the narrow band UVB radiation. So, this is the phototherapy machine. So, which mainly mechanism of action of this phototherapy is to increases the anti-inflammatory cytokines, which includes interleukin 10 and interleukin 13. So, the pro-inflammatory cytokines which are increased in case of psoriasis are going to be interleukin 2, interleukin 17 and interleukin 22. So, phototherapy by increasing the anti-inflammatory cytokines like interleukin 10 and 13, it decreases the pro-inflammatory cytokines. So, we have two methods, either with the application of narrow band UVB radiation or you have the PUA, which is psoriasis, along with an application of UVA radiation. So, UVB, the wavelength is going to be 3111 nanometer. In UVA radiation is going to be 320 to 340 nanometer. With 30 minutes prior application of the psoriasis, which is either a topical as well as systemic group of drugs. Next, if phototherapy doesn't work, next we have to follow systemic therapy, which includes or sometimes systemic as well as phototherapy go hand in hand, which includes methotrexate, cyclosporin, acitretin and then you have the apremilast. So, methotrexate, mechanism of action of this drug mainly is act on the S phase of the cell cycle. So, inhibiting the dihydrofolate reductase enzyme. So, prevent the conversion of dihydrofolic acid to tetrahydrofolic acid. So, preventing the formation of the folic acid and then multiplication of cell is going to be reduced. So, main side effect of these drugs which includes hepatotoxicity, bone marrow suppression and then teratogenic group of drugs, that is category X drugs. Next, you have the cyclosporin, which is a calcineurin inhibitor and then it decreases the interleukin 2. So, side effect of this calcineurin includes it increases the blood pressure, so which can cause hypertension. Next, you have the acitretin, which is the vitamin A analog. So, the example of this drugs includes acitretin, oral retinol group of drugs. So, side effect of this drug is mainly hepatotoxicity, teratogenesis, category X drug, and then can cause hyperlipidemia, that is increasing the lipid profile in the blood. That is lipid level in the blood, which is inclined cholesterol and triglyceride. Next, you have the apremilast, which is the phosphodiesterase 4 inhibitor. So, prevent the conversion of the CAMP to AMP. So, by increasing CAMP level, which is an anti-inflammatory, and then it decreases the pro-inflammatory cytokines levels. So, methotrexate, it is mainly used in various types of psoriasis like chronic psoriasis, erythrodermic psoriasis, and then you have the pustular psoriasis. Cyclosporin, it is used in case of erythrodermic and then severe form of pustular psoriasis. Next, acitretin, which is used in case of the pustular psoriasis, and then you have the apremnase, which is used in case of all types of psoriasis. Systemic steroids are usually contraindicated in the psoriasis. Only one condition where systemic steroids are used, which is going to be pustular psoriasis of pregnancy. So coming to the end of this discussion, so we have mainly read about the what is psoriasis and what are the cytokines, that is pro-inflammatory cytokines, which is increased in case of psoriasis, and what are the modalities of treatment to reduce these cytokines or prevent the cell proliferation. Thank you.